Thank you very much for joining us here on #RadioGP. This is episode 3 of our discussion from this evening, from the March episodes of our GP sessions here on Solihull Radio. Right, this section is all about dementia, and from my research, and I'm very lucky to have Dr Oliver Denton from Daleswood Health here with me as my medical genius and practicing GP, and just setting him up here for a really good discussion on dementia. Dr Denton, dementia.
Yeah.
Dementia, when I see programmes in the media and on the television, for instance, it's over 65s, and as they sort of go on, and is it really just a case of memory loss and sort of slowing down a little bit, or how does it work? Because I'm going to put my cards on the table. I hear Alzheimer's, I hear dementia. I'm not completely convinced on the differences between the two of them. Is it something that's brought on by other things? Is it a genetic... Oh, I've got so many questions. I'm so sorry.
That's all right.
Is it genetic? Is it treatable? Is it something... You know, and to put it bluntly, when you contract or you develop dementia, what do the patients actually pass away with? Because does dementia stop all, you know... I'm not making myself very clear, and I apologise for that. You are now my oracle on this, so I'm really looking to you to get some information, please.
So dementia doesn't necessarily happen over the age of 65. You can get early onset dementia as well, but it's basically the decline in brain function.
Right.
So there are lots of nuances to that. Alzheimer's is one specific type of dementia, but dementia is the coverall. Within that diagnosis, there are several other subcategories, if you like, but ultimately it's your inability to function as well as your brain once did. You can draw an akin to, say, arthritis. As you get older, your joints become less supple and
it
flexible,
wears down a bit.
and then they wear down until eventually your joints no longer work. Well, the brain is no different to any other part of your body. For some, they can still be running in their 80s and 90s. For others, they'll be crippled by the time they're in their 40s. And the brain is very similar. And I like to think of the brain a bit like your joints. If you don't look after them and you don't exercise, then they're more likely to have problems and wear out as you get older. If you remain active, if you keep doing things that are good, if you have a good diet, if you're exercising regularly, then you're going to last longer with your joints. Well, your brain's very similar to that. And we see dementia as an increasing disease, but that's simply because more of us are living longer because we've helped fix lots of the other conditions that we used to drop off a little bit earlier with. So dementia is certainly on the increase in terms of how many patients or how many people we see with it. But the rate of onset of dementia, I don't think, is increasing. It's not that we are suddenly developing more dementia.
Sure.
We're just lasting longer.
Now, let's go back to the Victorians.
Mm-hmm.
Did they have, the degeneration of their brains? Was it diagnosed as dementia? What happened back then compared to where we are now?
Blimey.
I'm not trying
just thinking back to when I was younger.
Yeah. Sorry, I didn't mean to give you that picture, listener. But what I'm saying is, let's not go back to the Victorians. Let's go back to pre-war. And we're seeing people with memory loss and loss of sharpness and, difficulty with their language and things like that. And I'm just thinking, why suddenly have we now got this umbrella term of dementia? Why have we then got subsections like Alzheimer's? And I'm just trying to understand the development process over a period of time. Is it something that is genetically predisposed for a certain type of population, or is it something, for instance, if I do a Sudoku every day, am I less likely to develop dementia?
Yes and no.
I'm not trying to put you on the spot. I'm just saying, is it a case of me doing a crossword and keeping going?
As I mentioned, some people, if you're very athletic and really sporty, then if you've lost a little bit, you might come down to everyone else's level. So if you're super intelligent and always have been, then actually it might be quite hard to spot a dementia because you're still able to function very, very well and do all the things that everyone else would. You've lost that initial element of dementia. Just to avoid any confusion, the sort of subcategories I was talking about, all dementias are where you have a reduction in brain function. But through science, through our abilities to understand, we know that there are specific parts of the brain that have caused that. And so when we don't really have an explanation as to why you've got a dementia, then we'd call it Alzheimer's. If you've had lots of tiny little strokes, and when we scan the brain, it looks like there's lots of little bits of brain that have died, then that's called vascular dementia or multi-infarct dementia.
Mm-hmm.
Parkinson's can equally result in a form of dementia. Lewy body dementia is another type.
Wow.
These are all subtle differences, and they can have slightly different stories, both before they're diagnosed, and that helps us to try and give some prognostic information to the individual or to the carers of that individual and plan care about that. So there's some value, and it also helps us direct what type of treatment is available. Largely, dementia is not a treatable condition. But for mild to moderate dementias, and only specific ones, specifically Alzheimer's, there are some drugs that we can use to slow the progression down.
And vascular dementia, for instance, if I take these different types from the overarching umbrella that we've got of dementia, it is an absolutely horrible onset, because it seems to last over a long period of time and the person is inside, but it's not the person that the family and the relatives and the people around them, their friends and their support structure have seen. And, people can go from, let's say, normal, what we know as normal, into somebody that can't control their emotions, can't live their day-to-day life over quite a long period of time, and that takes a lot of care and support from their team, doesn't it?
I mean, it's harrowing, and I think the reason it's such an emotive diagnosis is that none of us would wish it on our worst enemy. When we're looking at potentially the shell of an individual that has been lost, their personality has gone, the person that was once known to be is no longer there. And you mentioned what's the sort of end stage. Well, the worst thing that I see as a GP are individuals that have been wonderful. You look at the pictures on the mantelpiece and you look at a wonderful life, and physically they're often perfect. There's nothing wrong with them physically at all, and that's the worst and most horrible thing to witness and to try and deal with emotionally, individually, and to help the family deal with that. The important thing about dementia is, regardless of whether there is or isn't a treatment for it, and as yet there is nothing that will cure it, there are only things that perhaps slow the progression of it down in certain types of dementia. The most important thing really is to understand, if you have it, what will happen and how that will progress, because in the early stages you still have all your faculties, you still have the ability to make good decisions, you still have the ability to make good choices. And it's important at that early stage to have that discussion with your family, with your friends, with your doctor about what you would like. Because if we don't know, we have to make assumptions, and that's the hardest part sometimes. And I think we all, regardless of whether we're concerned we have dementia or not, should think a little bit more about what our choices are and document those. Discuss them with our families and express our wishes and wills at an early possible stage. And then really, once you have got the diagnosis and we know what you want, it's about looking after you and keeping you as independent as possible for as long as possible, putting services in place to make sure that you can stay where you want to stay and spend your time with the people you want to spend your time with. Sometimes just very simple things can make such a huge difference to an individual, whether that's changing how your meals are prepared, whether that's making the environment safer so that you're less likely to leave things on or to trip over things or to be secure in your own house. All of these things, if we know early enough, we can help and provide an independent living for that individual for as long as is possible.
I'm just reading some statistics here. The Alzheimer's Society, according to the Alzheimer's Society, there are about 850,000 people living in the UK with dementia. 1 in 14 over 65 will develop the condition. Over 65 will develop dementia, and the condition affects 1 in 6 people over 80. Like you said, it is degenerative over that period of time, and the curve, I suspect, gets quite steep towards the end. Tell me, what do people pass away from when they are suffering with dementia? Because I'm thinking about it from the perspective of the family. Yeah. Let's say it's a couple, and they've been married and they've had their golden wedding anniversary, and he is caring now for her after she unfortunately developed a form of dementia. What is he going to be seeing towards the end? What actually is the final elements?
It's incredibly broad.
Oh, okay.
Unfortunately, dementia isn't just a simple fading away. The most horrible thing for a couple sometimes is that they can become, or the individual can become aggressive or confused or disorientated. They lose the normal wake-sleep patterns, so daytime's night, nighttime's day.
Hallucinations?
Yeah, absolutely. They can think that, because of course your brain isn't working, so it doesn't perceive as well. It can confabulate, it can make things up. It can be incredibly distressing for that individual. And there's no control that they have over it. I mean, it's like feeling trapped in a nightmare sometimes, and you could have that loop of thought process going on. And certainly, when we look after care homes that have a lot of individuals with dementia, you can see those that are perhaps displaying childhood behaviours. There's those
they've regressed back into those areas because that's a part of their brain that still is functioning.
Absolutely, there are some. I understand. There are some that it was awful. I'd see one of my patients who constantly kept apologising, and oh, what have you done? What have you done? And I just felt that person must be trapped in this horrible nightmare, and the internal stress that produces. Must be awful, but it's how can we influence that and change that? And previously we've used medicines to sedate the individual, but we know that those aren't particularly good for you. So it's about trying to manage the environment as best as you possibly can, but that becomes incredibly labour intensive for that individual and that carer. And it's sometimes, as much as when we marry we promise to look after in sickness and health, you have to understand that is sometimes just far too much for any individual to bear, and they do need help. And as much as I admire and respect that individual's wish to continue to care for their life partner, it's sometimes harmful to them and harmful to the individual. And it's about having those honest discussions really early on as to how we can help, and accepting when it's a bit too hard to manage on your own. But as to how you end with dementia, it can be from simply just shutting off and not wanting to eat anymore.
Okay.
It can be that you've just lost the ability to understand when you're hungry or when you're thirsty, or it can be that you've lost the ability to swallow properly and you choke, or that you can't cough effectively because your brain's not telling you and you have a pneumonia, or it can be that you've had a fall. There's so many endpoints, but ultimately when you've lost all control of what your body is doing, conscious control of what your body is doing, then the subconscious starts to go as well, and that's when things unfold very, very quickly.
Okay. Thank you very much for your insight into the topic of dementia, the umbrella term. You have been listening to #RadioGP here on Solihull Radio. Thank you very much for downloading the episodes, and we hope that the information provided by Dr. Denton has been beneficial to you today. Like I say, if you want some more information or you would like to speak with Dr. Denton or his team, over there at Daleswood Health, head to daleswoodhealth.co.uk. We will be back next month with 3 other areas of discussions to help you with your monthly podcasts. Thank you very much for joining us.